Okay. So Jamie, I'm going to read your bio here, and then if you would like to add any additional information, just let me know, okay?
Sure. Yeah.
Okay. Jamie is the owner of Altitude Physical Therapy within Dynamic Strength and Conditioning in, where are you, New Hampshire?
Nashua, New Hampshire, right, a border town of Massachusetts.
Oh, okay, love it. I have some cousins in the New Hampshire, Vermont area. It's beautiful there.
Well, it's chilly right now.
Yeah, yes. She is certified in integrative dry needling from Dr. Ma's Institute. The mission of Altitude PT is to foster the recovery from injury, facilitate freedom of movement, and assist with the return to homeostasis by helping discover and address the root cause. Her expertise is in functional and comprehensive examination of treatment of pain and dysfunction associated with the multitude of injuries and disorders. Jamie's model of care is focused on one-on-one integrated assessment of movement to maximize performance. So is there anything that you would like to add to that bio, Jamie?
No, I think that it's a mouthful, but I keep reorganizing my mission as I, have more time in this practice setting, and, still discovering exactly what my role is or my title is. Like, that's still, it's a work in progress.
It is, but that's what I love, is that you're continuing to progress and evolve yourself, because I find personally, the more that I continue to learn skills, whatever they may be, skills of being a business owner, skills of being a practitioner, life skills, mom skills, then the better we're able to help our patients and clients, I think.
Absolutely, yes.
So, with all this, what do you really feel your area of expertise is, or what's your ideal client, your niche that you love to work with?
Sure. I have a unique opportunity where my practice is located. I'm directly inside a strength and conditioning gym here in town, and the gym itself is a host to a beautiful community of members, performance coaches, nutrition coaches. So you can call ourselves a wellness facility if you'd like, but really the community is what bonds this place the most. And given that, I have just a unique opportunity to work with a majority of the clients that actually attend classes here at our gym. So, right. So what's great is that I have the ability to see folks one-on-one in my clinic, and then I get to coordinate their care with the performance coaches here at the gym. So, I didn't make this quote up. I borrowed it from someone else somewhere in Instagram world, but, training is rehab, rehab is training. And I think certainly, I've come a long way from, the old school philosophy of having a patient come in the clinic, sit on the table, do 10 reps of a completely erroneous exercise and say, okay, now do this 3 times a week at home, and I'll see you, twice a week for 6 weeks. So it's so far from that model, and I'm so glad for that, so grateful for that. And the continuum of care that we provide here, because they're coming to our facility to move their bodies, is just a beautiful relationship.
Well, that sounds lovely. Tell me a little bit about your model then, how it differs from that erroneous exercise. When a client walks in the door with you, tell me a little bit about what they would experience. Right.
So in New Hampshire, we actually have direct access. You guys have direct access in your state as well? Great. Which is great. So that just means that anyone can come in and see me for physical therapy. They don't need a prescription from a physician, which is nice. It gives us autonomy. So the largest difference is that our clinic is an out-of-network clinic. We are considered cash-based. So in essence, not only do they not need a referral, but I won't be billing my physical therapy services to their insurance company. And the reason I choose to do this, and I would say the majority of people in the cash-based world, is to continue to give us that autonomy and allow us to best utilize our time together with our clients to figure out really what they need. So I have the complete pleasure and reward to listen to clients when they come into our clinic and hear really what's going on with them, not just they have back pain when they're deadlifting, but what's going on? How are you sleeping? What's your nutrition look like? What's stress? What's life like? What's going on with your gut health? And figure out where they're at. So in a cash-based setting, we have the ability to take that time to listen and aren't under the gun about, okay, I have to make sure I bill a unit of Cyrex at this visit or else, you know, Cigna's going to say, forget it, we're not going to charge you for that time, pay you for that time. So, so we first have the beautiful ability to take the time to listen, to see what someone needs. Also, being cash-based means that I don't have to be dictated by the insurance company to only work for 6 visits on a certain part of the body and then have to justify continuing otherwise. I really get to keep clients' charts open from that first visit, and we don't ever need to discharge them. They are able to come in one day and say, you know, my neck's been really bothering me at work, and it seems to be affecting what's going on with my arm when I'm driving. And then the week after, they could say, you know what, gosh, I was going up the stairs today, and my knee was really bugging me. So we have the freedom to treat them, to treat what's going on with them when they feel like it, you know, is enough of a need to be addressed by clinicians. So we give clients the opportunity to just work on what they feel like is important to them and what's going on with them, and hopefully save them a whole lot of time and a whole lot of money not going to their primary care physician, to the specialist, to, good God, I had a client who was just sent for an EMG. I said, we're still doing that? Like, what are we doing with that information? With someone with neck pain, with arm symptoms, why are we still spending the money, spending the time on these tests when, in the end of the day, what are we going to be doing differently? So, right. So, this world is fun. It's dynamic. It's you know, certainly growing in popularity. Staying out of network, staying independent from the insurance companies, and hopefully we're going to see a whole lot more clinicians in all sorts of fields in going in that direction, really truly to just give the consumer that autonomy.
I love it. And also that was great education for the patient or the client as well, to know what's available to them. And I think sometimes initially there might be a fear investing out of pocket for physical therapy services, but it sounds like your clinic is very holistic and provides more than just one shop body part treatment, that, you know, if they invest with you, for example, then they're going to be saving money and time by not going to as many doctors and specialists,
right,
paying large co-pays or deductibles, that sort of thing.
Absolutely. Absolutely.
So with your holistic model and looking at the whole person and really listening to their story, like you mentioned, and, you know, having the flexibility and freedom to work with the whole body, what does this really mean to you, this whole holistic wellness model? Personally, what does it mean to you?
Sure. Funny, wellness is like the new buzzword, right? So like when I like, you know, talk about what does wellness mean to me and how it fits in our world as clinicians. I think that actually this morning I was out on a run, and I was running by this woman who had this cute pink sweatshirt on that said wellness coach, and she was holding like a plastic bottle, you know, those plastic shaker bottles, full of some like orangish red thing. And I thought, oh yeah, this is why wellness is important to me, because unfortunately anyone can become a wellness coach now. Anyone can be offering advice now about how to make anyone feel better or help them achieve whatever goal that is, whether it be to be, to be able to exercise more, to lose weight, to sleep better. And so we have to be so cautious now about who is offering up that advice in our world of social media and Instagram and direct marketing, where, someone might be selling a protein shake and had great success on that protein shake. So they are now a wellness coach for that company and want to help you be well, like they feel like they are well. But unfortunately, they don't quite have the background, they don't have the training to really offer what I believe is true wellness coaching. It's such a, it's a really overused title, right? Exactly. So when I think about wellness, I really think about, again, the big picture, what's going on with them. What is more so the root cause of why they're feeling the way they're feeling? And pain is not a simple concept whatsoever. There's all sorts of exciting things going on in pain science right now. And in the older model of physical therapy, you'd go to your doctor with, say, shoulder pain, go to your physical therapist, work on, like you said, that one joint. Whereas what's really going on? What is really going on with that person? Is their stress level up to here? Their shoulders are just hiked up to their ears? Do they have a job they're not happy with? Do they have a stressful life at home? Like, what are they not moving their body well? What's going on? So wellness, I believe, is not a surfacing whatsoever. It's a deep look at what's going on at the root. And until you sort of address peel back all those layers to see what's happening, then I feel like, that's truly that's our goal as wellness clinicians, really, is to peel back those layers and find out what's going on deeper inside.
Yeah,
not just drink the shake.
Yeah, I agree fully. Getting to the middle core of the onion, so to speak.
Okay.
So what's the biggest impact tip you find yourself giving to clients if they're, let's say they're coming to you from one of the strength specialists in the gym?
So as far as just working on just overall wellness and well-being, is that what you're suggesting?
Yeah.
Yeah. So it's interesting that the breath, as we all know, is such a it's a little bit of a buzz thing right now. Everyone's talking about, the art of the breath and just take a deep breath, breathe deeply. But it's so interesting how none of us really know how to breathe properly. And the performance coaches I work with actually have taught me a whole lot more than many of my physical therapy colleagues and physical therapy professors, have about aspects of the breath. And I would say that is a large focus on what we work on a lot in one-on-one, is to teach someone how to breathe properly. And, are their ribs elevated and their shoulders are up to here? Are they using their upper accessory muscles to breathe and not allowing their diaphragm to be involved the way it should? That impacts everything in the body. It impacts the entire spinal position. It impacts the pelvic floor. So that is certainly a foundational, skill, you would say, that we try to encourage most of our clients to grasp when they work with us.
Yeah, not to mention muscle recovery and energy levels, right? If we're not getting the right
Sure.
amount of oxygen.
Sure. Absolutely.
As an entrepreneur and business owner, what's the biggest challenge that you personally have had to overcome or are currently working through?
Sure. I think a lot of us ladies that are moms can very easily say, well, it's doing all the jobs. The jobs as the business owner, as the mom, as the wife or spouse. So the balance, the juggle, I think, is the largest ongoing work in progress. But I would also say specifically for my field, my setting actually, is that there's such a small presence of females in this type of setting. So I find that a lot of the mompreneurs, the PT clinic owners that are women, a lot of them are in women's health as a specialty and pelvic health. A lot of them, like yourself, have a very strong foundation in Pilates and yoga and some other movement-based skills. Mm-hmm. And in the strength training world, it's interesting. I see on social media that there's becoming more of a presence, which is nice. But I'm still a little bit of a fish out of water being a female in this type of setting. So it is challenging, because when I do try to talk to some of the performance coaches or some of the other PTs I meet, male, about like pelvic floor function, that's not even my specialty, but it's something that in the strength training world, it needs to be absolutely complete awareness and part of what we're doing. Absolutely. So that's my current challenge right now, is being the lady amongst all the men out there.
We'll keep doing it because it's needed. I personally, being a yogi, yoga will always be part of my life, but I'm also hypermobile, so I understand the importance of I have to strength train. And so without it, I really feel it in my body, and I'm more susceptible to injury and that sort of thing, or pain. So keep on doing what you're doing, because it's an inspiration to all us as our females that we do need it. And I think the more knowledge that's out there, that the importance of strength training for females from people like you, then more females will get it as well. So keep on doing it.
It's funny, we were putting up some Christmas decorations and lifting the boxes and moving the tables, and I thought, most females wouldn't think twice about grabbing that 50-pound box of ornaments and decorations and bring it down from the attic or from the garage, or set up the tree or this and that. But for some reason, when it comes to exercise, we get scared. And I see how a lot of females like to trend towards the gyms for strength training that, are using the small weights, and they're doing the high reps because they think, I don't want to get bulky, I don't want to get big. But how can you expect that you can lift that baby off the floor, lift that toddler out of his car seat, lift the laundry basket, if you're not ever challenging your body to do that movement pattern with that weight?
Yes. Exactly. That's so true. I just found out my daughter's almost 40 pounds now, and long story short, I had to carry her over the Thanksgiving holiday, and I was like, yep, this is why I need strength training.
They find out the hard way.
Yep, exactly. So how do you incorporate some of this wellness and advice into your own life?
Exercise has always been so important to me. It's my mental health break, really. I love to run. I make sure that I still can schedule time during my day to move my body somehow. So that's always been a priority for me. And as far as nutrition, I have teamed up, and I've worked with my own nutrition coach, who's a functional nutritionist. Her name is Erin Holtz. If anybody is looking for a functional nutritionist, just to listen to them, and same idea, just help discover root cause of how you're feeling and what's going on, and look at what you're intaking. Erin's fabulous. But, so taking, steps towards finding my own tribe, my own team to help me be the best person that I can be physically. And so that carries over, as you know, with your kids then too, trying to reinforce some of these healthy patterns with your children. And, you don't want to be, the mom on the soccer field that's bringing the homemade granola bars all the time. But you know what, if that's what it takes, just that little nudge of you know what, this is just a better choice. And, you just ran around and moved your body, and we want to fuel you and recover you well. I mean, it doesn't mean that they don't get donuts after their game sometimes, but at the end of the day, we're just trying to do our best job and do our piece to just demonstrate to our children that this is, when we have choices, we just always do our best to make a better choice.
Yes. Yeah, I love that. Well, Jamie, we're going to wrap up here. So can you leave some contact information, maybe your website or an easy way of people to get a hold of you if they're in the New Hampshire area and they are looking
Absolutely.
for a wonderful physical therapist?
I appreciate that. I will do. Thank you so much for having me.
Yeah. So what's your website?
So it's altitudeptnh.com. And then same on Facebook, it's Altitude Physical Therapy, as well as Instagram. It's Altitude PTNH. Right, I got that.
Beautiful. Well, thank you so much. And I will look forward to sending this video to you, and we'll just be in contact. Thank you so much for
Perfect.
your time.
I appreciate it. Thanks so much.
Okay, I'm going to just end the recording now.
Yep.